Did you know that some diabetes symptoms are unique to women? Are you aware of what these symptoms are? As we navigate through the maze of health information, it's crucial to understand how conditions like diabetes can present differently in women. Intriguing, isn't it? Well, the world of health and science never ceases to surprise us. So, buckle up for a fascinating journey as we explore this topic. Stay tuned as we delve into the top 10 common signs of diabetes in women. Before we dive into the symptoms, it's crucial to understand what diabetes is. Diabetes is a chronic disease that affects how your body turns food into energy. Most of the food we eat is broken down into glucose, which our bodies need for energy. But to use glucose, your body needs insulin, a hormone made by the pancreas. In diabetes, this system fails. There are three main types of diabetes. Type 1 is where the body doesn't make insulin at all. This is usually diagnosed in children and young adults. Type 2, the most common form, is where the body doesn't make or use insulin well. This can occur at any age, but it's most often diagnosed in middle-aged to older people. Lastly, there's gestational diabetes, which some women develop during pregnancy. Now that we've understood what diabetes is, we can move on to its symptoms. Recognizing the signs of diabetes is the crucial first step towards managing it. This potentially life-altering condition often begins subtly, leaving its traces in the form of small changes in your daily routine. What might seem like insignificant occurrences could be your body's way of alerting you to the presence of diabetes. Let's delve into the first 3 common signs of diabetes in women, a demographic that sometimes can overlook these indicators due to their often busy lifestyles. The most notable sign is frequent urination. This symptom can be easily mistaken as merely a byproduct of increased fluid intake. However, excessive urination, particularly at night, can be one of the earliest and most telling signs of diabetes. It's a condition medically referred to as polyuria. When your body is unable to regulate glucose, it tries to get rid of the excess by increasing urine output. This is one of the first symptoms of diabetes that people notice, but unfortunately, many people dismiss it as a minor inconvenience rather than a potential health warning. Elevated glucose levels in the bloodstream can cause the kidneys to work harder to filter and absorb the excess sugar. This extra work can stress the kidneys and cause long-term damage if the diabetes remains uncontrolled. When the kidneys can't keep up with the sugar, the excess is expelled through your urine, drawing fluids from your tissues, which in turn leads to an increased frequency of urination. The second sign to watch out for is excessive thirst. This, known as polydipsia, typically accompanies increased urination. It can be seen as the body's natural response to the loss of fluids through frequent urination. As your body loses more fluids than usual, it tries to replenish them by making you feel thirsty. This results in a constant feeling of thirst. This can, therefore, create a continuous cycle of drinking and urinating, which can be quite disruptive, particularly during the night. It's important to pay attention to these changes in your body and report them to your healthcare provider, as they could be the first signs of diabetes. The third sign we will delve into is an unexplained weight loss. Although many people might not consider weight loss a cause for concern, particularly trying to shed a few pounds, an unexplained decrease in weight could be another classic sign of diabetes. When the body cells aren't getting the glucose they need for energy, your body begins to break down muscle and fat for energy instead. High glucose levels lead to loss as your body is unable to absorb the glucose for energy. It starts to burn fat and muscle for energy instead. This weight loss can occur even when you are eating and drinking normally, or even consuming more than usual. These signs, though seemingly common, are far from normal. It's essential that you pay attention to your body and seek medical advice if you suspect you might be experiencing symptoms of diabetes. It's also crucial to remember that while these are some of the most common signs of diabetes in women, this doesn't mean they're the only ones or that they will occur in every individual. Each body is unique and may exhibit different signs and symptoms. However, these 3 signs should definitely alert one to the possibility of diabetes. Early detection is the key to managing this condition and reducing the risk of further complications. These are most common signs of diabetes in women. Early detection is the key. From our previous discussion, we learned about the first 3 common signs of diabetes in women. Embarking on the journey of further understanding, now we are going to venture deeper and explore the next set of symptoms that might indicate the presence of this common but often overlooked condition. The fourth sign that we must pay attention to is an amplified sense of hunger. This symptom is not just about feeling constantly hungry, but it is rather a peculiar kind of hunger that seems insatiable. It often occurs when your body is unable to derive the energy it needs from the food you intake. The food might be rich in nutrients, but if your body is unable to process and absorb those nutrients, it could lead to an increased sense of hunger. This is your body's way of trying to gain the energy it needs. Your body, in its desperate attempt to compensate for this lack of energy, sends signals that provoke the feeling of hunger more often. This can even happen shortly after you've had a meal and should be feeling satiated. The fifth sign that we must be on the lookout for is persistent fatigue. Fatigue is more than just feeling a general lack of energy. It is a state of constant exhaustion doesn't seem to lift, even after you've had a good night's sleep. If you're feeling tired all the time, regardless of how much you sleep or rest, it could be a probable indication that your body isn't effectively converting glucose into energy. Consequently, this lack of energy conversion often results in feelings of exhaustion and lethargy. These feelings are not just physical but creep into your mental state as well, making you feel emotionally drained. It's a kind of weariness that can significantly affect your daily activities, productivity, and overall quality of life, prompting the need for immediate medical attention. The sixth sign that we need to address is the occurrence of blurred vision. High levels of blood sugar can cause the lens in your eyes to swell, adversely affecting your ability to see. Overly high blood sugar levels can lead to changes in the shape of the lens in your eyes, causing them to swell and alter their ability to focus, thus resulting in blurry vision. This is a symptom that, if left untreated, can escalate and lead to severe vision problems, even resulting in vision loss in the most severe cases. A clear understanding of these signs is crucial in the early detection and effective management of diabetes. You might wonder how these symptoms are, since they seem to affect different parts of the body. However, they are all linked by common thread. They are all connected to how your body processes glucose. It is essential to recognize that these symptoms are not just random occurrences, but possible signals that your body is sending out to alert you about its inability to process glucose efficiently. If you are experiencing any of these symptoms, it's highly recommended to consult a healthcare professional immediately. Remember, early detection is the key to managing any health condition effectively. In the case of diabetes, it can be life-changing and even life-saving. So, let's not underestimate the power of knowledge and awareness. Stay tuned to understand why early detection is so important in managing diabetes. Continuing our voyage and grasping the reality of diabetes specifically amongst women, we're now about to unravel the seventh and eighth key indications to be alert for. The seventh sign is best described as chronic, slow-healing sores or frequent infections that become concerning. If you've started recognizing that your wounds and sores are taking an unusually longer time to recover, or that you're experiencing repetitive infections more often than what appears to be normal, it's a potential indication of diabetes. This happens primarily because the elevated blood sugar level in your body interferes with your body's innate healing capabilities and its resistance to infections. With an increase in your blood glucose level, your body's white blood cells, the warriors inside your body constantly fighting off infections, tend to lose their effectiveness. This can consequently lead to a sluggish healing process and an increased vulnerability to infections. Moving on to the eighth sign, which is characterized by patches of darkened skin. This condition, medically recognized as acanthosis nigricans, is most commonly observed in areas where the skin folds over itself, such as the armpits and neck. These patches can feel soft, velvety to touch, and may even display either a brown or black hue. The root cause of this phenomenon is insulin resistance, a condition frequently associated with individuals suffering from diabetes. When your body starts to resist insulin, it leads to a rise in the insulin levels in your body. The surplus insulin can then trigger skin cells to reproduce at an accelerated pace compared to what's considered usual, resulting in the manifestation of patches of darkened skin. At first glance, these two signs might appear irrelevant to diabetes, but delving deeper, they are directly associated with how your metabolizes glucose and insulin. So, if you observe any of these signs, it's crucial to seek immediate consultation with a healthcare professional. In our forthcoming segment, we'll explore in depth the critical role of early detection in efficiently managing diabetes, so stay tuned. One may ponder, why is early detection of diabetes so pivotal? Let's delve a little deeper into this. Detecting diabetes early is much like boarding a train before it leaves the station. It's considerably easier to manage when we identify it at an early stage. This is because diabetes in its initial stages can be effectively managed through lifestyle changes and medication. Additionally, early detection can ward off complications associated with diabetes such as heart disease, stroke, kidney disease, and vision problems. It's a domino effect. One issue triggers another. Spotting diabetes early can break this chain reaction. But how do we identify diabetes early, particularly in women? There are certain symptoms to be wary of. Apart from unexplained weight loss, increased hunger, and constant fatigue, are final two signs we are going to discuss in this scene. The first one is yeast infections. If you're experiencing frequent yeast infections, it might be a sign that your body isn't able to regulate glucose levels effectively. The second one is polycystic ovary syndrome. If you're noticing symptoms of PCOS, it could be because your insulin resistance is increasing, a common problem in women with diabetes. Another compelling reason for early detection is the allowance for immediate treatment. The sooner the treatment commences, the better diabetes can be managed. Diabetes management isn't just about medication. It also involves lifestyle modifications like eating healthier, regular workouts, and maintaining a healthy weight. These alterations can drastically decrease your risk of developing complications. The economic impact of diabetes can also be minimized through early detection. The expenditure associated with managing diabetes, its complications can be quite hefty. Identifying and controlling diabetes at an early stage can potentially save a substantial amount of money in the long run. In conclusion, early detection of diabetes is critical. It enables timely intervention, averts complications, and promotes better health. Early detection is your best defense against diabetes. It's always better to be safe than sorry. So stay vigilant about your health, go for regular medical checkups, and listen to your body. It's the best favor you can do for yourself. You may be asking yourself, what if I notice some of these symptoms? That's an excellent question, and honestly, the kind you should be asking. If you find yourself experiencing some or all of the symptoms we've discussed, along with the specific signs of diabetes in women such as blurred vision, slow healing sores, and frequent infections, it's crucial not to dismiss them. These could be your body's way of signaling that something is off, and it's essential to take notice of these warnings. The initial step is to document your symptoms. When did they begin? How frequently do they appear? Are they worsening or remaining constant? These are all significant questions to ask yourself. This information will be invaluable when you consult with a healthcare professional. Keep in mind, while the internet is a useful source knowledge, it cannot replace a visit to a healthcare provider. It's tempting to self-diagnose, but we must remember that diabetes is a multifaceted condition that necessitates a professional diagnosis. This leads us to the subsequent step, speaking to a healthcare expert. It could be your family doctor, a nurse practitioner, or a specialist. Seeking their advice is crucial. They can administer the necessary tests to confirm or dismiss a diagnosis of diabetes. These tests usually involve monitoring your blood sugar levels, either through a fasting blood sugar test, an oral glucose tolerance test, or a hemoglobin A1C test. If you are diagnosed with diabetes, your healthcare provider will help you navigate the next steps, which may involve alterations to your diet, physical activity, medication, or a combination. Your treatment plan will be customized to your unique needs and lifestyle. However, if you aren't diagnosed with diabetes, but continue to experience these, don't lose hope. It's important to keep a close eye on your health and keep your healthcare provider updated. There may be other underlying health conditions require attention. It's also worth noting that even in the absence of these symptoms, regular health checkups are crucial. They form an integral part of preventative healthcare and can help identify potential health problems before they escalate. In conclusion, your health is your most precious asset. It's vital to be attentive to your body and to respond when needed. Don't neglect your health. If you observe any of these symptoms, it's critical to consult your healthcare provider.